Okay, we'll go ahead and get started as other folks join us. Good afternoon and welcome to part 2 of our webinar series, Supporting Inclusive Practices Building. My name is Kristen Brooks, Executive Director from the Riverside County Office of Education. And joining me is Dr. Seema Cuddy and Kevin Schaefer. So thank you so much for being here today. Just a couple of side items there that you are muted and your video is off for now, but we anticipate this to be an engaging webinar. And so as we move through the content and get to some questions for the audience, we hope that you would go ahead and unmute or broadcast your video when you want to go ahead and respond or chime in and offer any information related to the topic. So hoping again just to engage everyone in this webinar series and remind you also that it's being recorded and archived. So if you have team members who are not able to join us this afternoon, you will get the link to the recording and you can go ahead and share that with team members or maybe in debriefing together following this webinar event. So what to expect today out of part 2? We're going to do a brief revisit of the blueprint. As you know, this series is following through the steps and stages of our blueprint. So we want to revisit that, talk a little bit about our envisioning, the previous webinar, and then move straight into the building for this webinar and dive into that. Again, some sharing out regarding each of those components of the building stage. And then following that, we'll talk about next steps, some different events that are coming up. We've added quite a few since our first webinar, so we're very excited to share that with you. And then some reminders about our work together, and finally a survey at the end. With that survey, we're really asking for your input, your honest, candid responses about your engagement in these webinars in this format. If you like just kind of hearing content and being a participant in that manner, or if you prefer to really engage and share out with the audience, kind of what your thoughts are, if you prefer something recorded and archived that you can view at your time and share back out following that. So that's important information as we get to the survey piece. So kind of going back to our envisioning, just a reminder about really the project in general, that this is a process. This is definitely not something where we are gung-ho for inclusion and say, you know what, we're going to make all this change in our systems and our policies and our practice and our culture in one day. This is definitely a shift to go from our current state to our future state where we want to be. And the important piece within this blueprint is in that envisioning. And so oftentimes what happens is, and we'll click to the next slide there. Often what happens is we get really excited about a new idea or wanting to shake things up a bit and be the disruptors, and we move straight to building and implementing, or maybe even scaling up something that we've been working through in previous years, but we sometimes skip that envisioning. And that as a foundation is such a critical component of our work, where we have that cohesive leadership and we're very clear about our urgency and our purpose, and really communicating that through both vertically and horizontally through the leadership teams down to the student level. And of course, always starting with that persuasion and those first adopters as we're rolling out anything new, or even going back and seeing if something has worked for our community in the past. And so really having that envisioning piece as a foundation sets the stage to then be able to build it right. So we want to envision it and then design it right the first time, where it's really rooted in data, in clear strategies and very measurable and short-term wins, right? Short-term goals and objectives, and then build those policies and practices around that. And so it's definitely a process, and it's not something that we as a project anticipate will change the earth, in the next couple of months, but definitely making progress toward that. We often talk about going slow to go fast, but we don't want to go so slow that we slow down and stop. But we also don't want to go so quickly that we start implementing every shiny object, that we really want to be intentional in our design and that it ties directly with our vision, mission, values, and goals and the clarity of our purpose. So that's what this next stage is all about. So I'm going to hand it over to Seema to take us, or I'm sorry, to Kevin. The next step.
And thanks, Kristen. I just wanted to emphasize what Kristen just said in terms of intentionality. As we begin the process of implementing inclusive practices within our organizations, that intentionality piece is so critical. And you've probably heard time and time again around continuous improvement. If you've been to the Carnegie Institute or you've looked on NERN through the implementation science process, It takes time to implement inclusive practices and intentionality to set up the structures such that they're sustained over time and improved over time. And if we don't have that intentionality, then we get that pendulum swing and we're trying new things all the time. Whatever the shiny new object is that's working in an organization that's nearby, or that you've been looking at mirroring the structures, it creates a pendulum swing such that your administrators, your teachers get frustrated and they want to move on to something else. But this intentionality piece is so critical in moving through the continuous improvement process that we continue focusing on inclusive practices as a whole and improving and scaling up and innovating from the point at which you're currently at. So we look at it through the lens of the Plan, Do, Study, Act, or the PDSA process. And in a moment, Seema is going to be addressing a Plan, Do, Study, Act worksheet that makes it more concrete in terms of an interactive process to document the work that you're doing in very specific areas. So the Plan, Do, Study continuous improvement cycle is used for making small incremental improvements. And what that means is at the onset of this process, you're determining what the scale of change or the test of change will be, how large it is, how small it is, and how much improvement you want to make. And remember, this is at the beginning of the Plan, Do, Study Act. You're not implementing, but you're planning for the implementation of a sustainable innovation. You're also either looking at defining and or refining newer existing programs. And many people think of the Plan, Do, Study, Act process as a starting point with something new. It's also looking at what you're currently doing and how you might improve through the reflection process, and then moving forward and scaling up from that point. So it could be new or it could be existing programs or practices. Always with the lens of scaling up. How do we take a process, a program, a practice, an innovation that's working at a small scale and enlarging that across the system to ensure that other students are availing themselves of the program or practice that we've determined is effective within our population. And then the other piece that we're looking at is how do we align the policies and guidelines for the innovation that we've determined is successful within our population or within our organization? How do we develop policies and practices and guidelines such that they're reflective and they also have an accountability measure so that there's an accountability, a level of fidelity of implementation throughout our system, and that everyone is communicated and understands the purpose of what we do in our organization, across the organization, as Kristen said, both vertically and laterally. And just to quickly go through each of the PDSA stages, beginning with plan. And again, the plan stage is so that we have a level of intentionality, so that we know the direction that we're moving, so that we're actually taking the time to reflect on practices that we believe will be effective and putting those structures in place before it's rolled out or implemented to the larger organization as a whole. So to begin the plan process, you're looking at your problem statement. What problem are you trying to solve? What's the problem of practice that your shared leadership team is trying to solve, which gives you really the direction that you're going to be moving as a team, eventually as an organization. You're going to be asking yourself specific questions. You're going to be making predictions. And without those predictions, you're unable to determine whether or not you've met the goal that you've set out for yourself when you get to the study part, the study stage. So when you look at the data in the study stage, you're reflecting back to say, did we make the progress in the way that we predicted that we would? You're going to plan to carry out. You're not carrying anything out at this point, but you're setting up the structures, the infrastructure to ensure maximum success. And then Also, you're planning for data collection. What data systems do we currently have in place? What data systems do we need to ensure are in place so that we're able to progress monitor and determine whether the plan is successful, or we need to change in some way that we'll get to when we talk about the act or adjust stage. Moving into the do is when you actually carry out the plan. This is the first time the implementers, the individuals who are actually going to use the innovation, will be part of the process. So you're looking at the training piece, you're looking at the coaching piece, you're looking at the fidelity of the data collection. You're going to document the problems, and you're also going to document any unexpected observations and start looking at the data. This process through the Plan, Do, Study, Act is always based on data decision-making, database decision-making, so that you can always go back, you can review the data, and you can make determinations on next steps, and it will guide your ship in a very specific direction. Moving into the study and check stage, you're going to finish up your analysis of the data, and then you're going to compare the data to the predictions that you made in the plan stage. So when you're planning, you're making predictions on what outcomes this innovation will provide. In the study phase, you're looking at whether or not you made the progress and that you've met your goals based on the predictions that you expected, that your team expected in the plan stage. You're going to compare that data, and you're going to summarize what is learned. And then in the final stage, the act stage, you're going to look at what your next steps are. And in some cases, you might abandon that innovation depending on the data, what the data shows you, and the conversations that the team is having. So you might adjust, you might adapt, you might adopt, or you might abandon the innovation. So the data-based decision-making component of PDSA is critical in determining what your next steps are. And it's also important to know that this is not a one-cycle process, that you continually go through this PDSA process until you've improved to the point that you decide that you would like to scale up to the broader audience within your organization. So if you think about it in terms of a process, you're not looking at a back and forth of a pendulum swing. You're looking at a continuous process based on data that is more linear, sequential, and cyclical. Next slide. And then we'd also like for you to reflect, and it's a couple rhetorical questions. Based on the problem of practice your team is trying to solve or improve upon, what phase of the PDSA cycle are you currently addressing? And one of the important components of this question is how you've defined your problem of practice. Is it improving your inclusive practices within your organization, or is it more specific around implementation of an inclusive practice, such as UDL or co-teaching or implementation of PLCs? So we're going to give you just a couple minutes. Reflect on that problem of practice. What phase are you in? And are you in your first cycle of that phase? Now that you have a kind of a framework in front of you, where would you put your organization on the implementation of the innovation based on your problem of practice?
Okay, we are unmuted. I think.
You are, Zach.
Oh, can you guys hear me? Hear us?
Yes, we can.
So now that we've been through the PDSA process, we wanted to take you through not just the blueprint, the building component of the blueprint, but we wanted to take you through the PDSA worksheet. And the PDSA worksheet is a concrete process. It's an interactive document that you'll be filling out with your shared leadership team, along with the assistance of your assigned exemplar LEAs and Dr. Cuddy, Kristen, and myself. To show the progress that you've made over the course of the year, and will also be used as one of the artifacts that we turn into CDE at the end of the year. So you should have a copy of the PDSA worksheet from our earlier webinars, and we'll also send it out after this webinar. But it takes participants through the PDSA process in a 4-page document that documents pretty much what we've just talked about, but breaks it into very specific questions and sections that will get your team to think about the components within each of the PDSA stages. And with that, Seema, I think I'll turn it over to you.
Thank you. All right. Okay, so this is where we are going to start looking to you for your engagement, interaction, your thoughts, your ideas. And we don't have to stick to the questions that necessarily stick to, per se to the questions that we are asking. The idea behind this webinar is really for all of you to share your experiences, your questions, your expertise, your doubts regarding the building, in regards to the building stage. And what we have tried to do here is we have tried to set the stage by identifying a couple of questions that might prompt the discussion. So we welcome all the input that you can provide. And we'll start out with data. Now, data, as you know, SIP is very, very particular about data. We encourage you to use it not just to monitor your progress, but throughout the process, even starting with identifying your problem statement. So what I'd like to start with is just this simple question. When and if you did identify a problem statement, what were the types of data that you collected? And we have different options here. Simply type into the chat. You can choose, depending on your specific situation and the problem statement that you were trying to solve. It could be one, it could be more. So go ahead and tell us what were the different types of data that you used in order to identify a problem statement, and we'll go from there. So go ahead and just type in, was it demographic data? Was it just case-based data? Was it perception data? Did you actually do like a survey or some sort with your staff in order to understand their needs and in order to understand the problem better? So looking for your input. I don't see any responses yet. Is anyone having any difficulty accessing the chat? All right, Emily. 10 points.
Yeah.
All right, so you said one or more of the above. Well, let's see, achievement data, of course. And I think that's so specific to the problem statement that you are trying to solve, right? You could use just one piece of it, or you could use many more. Maybe we had a lag, but now we're seeing a lot of different, different answers coming in. Great, compliance review findings, case miss, perception data, wonderful.
And Heather, don't feel behind. Your group's not behind at all.
No, don't worry about that, Heather. I think just approach this from, if you have used any kind of data to solve a problem, and don't even take it per se saying this is root cause analysis, any kind of data that you have solved. I think we just want to have an idea of the different types of data that people are using in order to identify and solve their problems out there. LRE data, great.
I think something to really consider too. I see Heather just mentioned D, the overall dashboard data. And in some cases with students with disabilities, we focus on very specific like LRE indicator data, and we develop our problem of practice. In some cases, we've had a lot of success working with districts on the dashboard data and how students with disabilities fit into the overall picture in terms of equity and access, and then kind of connecting or integrating that very specific special education indicator data into that, like LRE, and making those connections so that students with disabilities are also connected to the dashboard data, which in many cases are connected to the LCAP development.
Yeah, and I saw, Charles, you said you F, but started looking closely at C, at achievement data. And I think that's really important because sometimes we take just a quick gloss over the data and go, okay, well, those are the numbers. But really, what does that mean? Where's that coming from? And how do we really dig deeper into that to be able to create some change around, you know, what we're seeing, to be able to pinpoint our goals as we know and understand the data deeply.
Mm-hmm. Yes, and I think the other important point to remember is also that you have to always think about the data that you have in front of you, but you have to frame those questions that you're asking, which is why we are talking about the problem statement, because that will lead you to then question, is the data that you have adequate? What other sources of data that do you need? And I think that is a very important point for you to always be considering, and then to go back as you progress monitor, to go back and look at the same data points as we talk about goals and measures later on, in order to see just what kind of progress are we making on those specific areas.
And just a quick note about data quality too. So sometimes when you look at the data and say, wow, that's surprising data, go back and see how is that data being input and pulled, you know, the phrase dirty data in, dirty data out, you know, so we want to make sure that there's quality data that we're reviewing that is reflective of our communities.
Great. All right. So then tying this back into the PDSA worksheet that we just went through, what we're looking at is the first 2 pages of the PDSA worksheet, and this deals with the plan cycle, right? And so the data, this is where at the top where you see the problem statement, this is where you would identify what is the exact problem statement that you're trying to define over here. And all the data pieces that you are considering and that you think additional data that you need to consider would be documented here. Now, I feel like I've read about this, one thing that I read about the PDSA worksheet struck me as really true. And it said that the PDSA worksheet is really, it's a tool that stops your impulse for immediate action. And I love that statement because it really helps you to stop and say, yes, I want to jump in and I want to correct this problem, but if I take the time to just document what I'm doing, it'll help me think through what I'm doing, but it'll also document this for posterity. So later on, when you or someone else in your organization wants to come back and see what were the measures taken, what was the data that was looked at, who was involved in this process, what is the methodology that they used, it is such a useful tool to document everything that you did in order to attain the goals that you set out to, right? So I think that is the value that the PDSA worksheet brings. All right, so moving on to, and really, let's start with the root cause analysis, and we're not going to dive deep into this. We are going to be putting out a pre-recorded webinar, which will introduce root cause analysis in much more detail. It will talk about the different methodologies that you can use, but just a quick snapshot of what root cause analysis is. You have a problem, you know something's causing the problem, what are the root causes? That's what you use to analyze and identify those root causes. And then you plan and you strategize in order to either eliminate those problems or reduce those problems. Now, listed over here are the different methods in which you can, you can use to do a root cause analysis. The 5 whys are the most common. It's really just asking why, until you get to the actual root cause of the problem. But as I said, look forward, just kind of look out for that pre-recorded webinar that we'll be putting out soon. But the next part is where I'd really like you to unmute when you're talking and share out what your experience has been. So I'd like to hear from you whether you have led or participated in a root cause analysis process within your district organization. It could be within your present one, or it could be in a one that you had been part of. And if so, which methodology did you use? And even if you did not use a specific methodology, that's fine. What we are really interested here to know about is, did you use a root cause analysis process? What did that look like? How was that experience? So anyone who would like to jump in and share about their experience, you can go ahead, and you're all unmuted. So go ahead and unmute yourself if you need to, and please share.
This is Heather. Can you hear me?
Yes, clear. Thank you.
We've done a variety of root cause analyses, for different activities. And the two that we've used so far are the 5 whys and the fishbone. And just personally, the 5 whys for me seemed a little more informal, and kind of took us a little all over the place, where I like the fishbone. I felt it was a little more directive, at least in the times we've used it. So that's just our feedback.
Great, thank you, Heather. That was very useful. The 5 whys, as Heather mentioned, is the most informal, and perhaps that is why it is used very commonly, not only in education, but across various different industries. Does anybody else have any other experiences having led or participated in an RCA process?
It looks like Jessica Little from Santa Cruz County office has used just about every one of the processes, including empathy interviews, which is also one of my favorite, at really getting at the user's perspective. And in our SELPA, we've used process mapping. We went a little crazy and like to use process mapping for almost anything. And we process mapped our professional learning development process and learned a ton about different perspectives around that process.
Great. And Zach Smith from Sanger just mentioned that he has done a lot of empathy interviews in Sanger to determine user perspectives. So thank you for sharing that. So it really depends on the different, do you feel that you gravitated to one or the other methodologies for a specific reason? Was it something that your organization already used, or was it just the comfort level or the expertise involved with regards to all the participants, what they were comfortable with, or what they had prior expertise in?
In our case with the empathy interviews, this is Zach from Sanger. We were trying to get, it was twofold. We knew that teachers needed to get buy-in for specifically this was for universal design for learning. And we knew that if they heard from kids, that would help them see or get the kind of the moral imperative of this. And then as another reason was it, like hearing from the kids and having support/teaming where kids were giving teachers feedback in their lessons and kind of working as a work group really helped actually put the practices in place. Because it's one thing if a teacher hears like a presenter talk about strategies that work for kids. It's another thing if a kid is saying, hey, like this works, or hey, this doesn't work. So it really got down to the root cause of why things are working or aren't working when the teachers could just ask kids.
Right.
This is Jason Stricker with Sanger as well. And another component for us is the discussion around FAPE offers and why a student may have an opportunity for a general education placement that is not necessarily driven by academics, that there are other reasons: communication, independence, social skills, safety. We use just a variety of measures through a strengths based conversation. And so often for us, that process really pretty clearly explains to a team, general education teachers, parents, why a student really is ready and appropriate for that least restrictive environment. And that's just the process we've had in place for many years now.
Great. And Jessica Little also sharing out that empathy interviews, and they have felt are great for perspective, and they're especially important when you have teams involved that don't share the same philosophy and foundational beliefs about the work that need to be done. So I think Sanger and Jessica sharing kind of the same perspectives, which is it really helps to get to the root in a very in a way that is very real to people, that ordinarily data, just putting numbers in front of them, would not yield, right, the same results. So I hope I captured that accurately. Okay, just curious. So in a root cause analysis process, you start out with an initial hypothesis, right? You have a rough idea, a guesstimate of what that root cause might be, and then you go through the process. Is it your experience that what you started out as being the initial hypothesis actually panned out to be the actual root cause? What are your thoughts about that? So did your hypothesis actually come true in the root cause analysis process? And maybe this requires some thinking because you have to go back and think about it.
Think about some of the teams that I've worked with in the past where they thought, well, for sure, we have barriers around professional development or around funding or facilities. But then when really taking a look at the data and sitting around the table and hearing different perspectives, it came to a very different cause. So yeah, I'm curious about other folks.
And continuing to ask the question, this is why I think the 5 whys are so important, continually asking the question, because the first root cause you come up with may not be the root cause that's actually causing the issue. In a number of the cases that we worked with around the PIR process and determining a root cause, the immediate root cause always seemed to gravitate toward, that's our students, or it's the parents' fault. But when we dive a little bit deeper, we understand that it's more of a structural or a cultural root cause that really needs to be addressed, that will eventually change, the student or the parent perspective.
Correct. Okay. Well, thank you for all your input there, and stay with me as we kind of go through the next steps here. So again, this is the plan worksheet, and you can see in terms of documenting what you're doing, you have specific areas for the root cause analysis in terms of the processes and the tools that you use, what were the results of the root cause analysis, and who was involved. So who was involved in actually doing the root cause analysis and then in planning the next steps to be put forward, right? So just kind of connecting the PDSA worksheet back to what we are talking. All right, so now moving on within our building stages to the strategy phase. Now, all of what we are talking about is really strategy, but what I'm really interested about is you had a problem statement, you did a root cause, and then you probably came up with a plan of action. Now, I would like to know, what was the scope of your initial plan of action, and why did you either limit it or go full-fledged and say, yes, we're going to do everything that's involved? Can anyone speak to what was the approach that they took in regards to scope of their initial plan of action and why? So in other words, you said, there are a lot of things we have learned from this. We need to address all these different things. Did you start out with a few of them and then target those, or did you kind of go small? Go ahead, Heather.
I think it depends on the different times we've done this work. So sometimes there are some easy fixes that can give you some early successes. Mm-hmm. So you may have prioritized some of them, and some of the things may take longer, or perhaps you need to have those early successes to even be able to challenge them. So usually starting off a little smaller and not as ambitious just to get those early successes.
Okay, thank you. Appreciate that. And I think if you look at any of the change management books, they are going to mirror exactly what Heather said. Start with the small wins. And I also see in the chat box that Charles from Covina Valley is saying the same exact thing. So they started small. They implemented where in a way that they felt that they could show immediate success, and then they grew the program from that success. So they scaled from there. And I think, I'm sure in doing so, you learn a lot of lessons. I think that's the first advantage. You learn a lot of lessons, but that immediate win that you get also goes back to what we were talking about. It grows your base of supporters who believe in what you're doing then. So it's really important to that culture piece and getting those first adopters and second adopters and third adopters who will support your cause and bring it to success. Go ahead. Again, Zach mirroring the same thing. We are a district that generally does smaller scale work. So not action planning yet. And I love the interaction in the chat box between our participants. Really love that. Quick wins. Okay, quick wins, short wins, anything that gets people encouraged about the value of what you're doing is what is important. So then I guess that makes sense. When you wanted to do small, when you wanted to go small, were there, and you were kind of looking at the overall strategy, were there any successes, challenges, barriers that you had to overcome that come to mind? So I'm sure you encountered many, but any specific ones that you'd like to point out that could be learning lessons for everyone involved? All right, so Jessica is writing that you have to make sure you have the right people at the table. Well said. I cannot agree with you more. I think that is crucial. And Zach is sharing out that the tipping point for when to move to a full district model. True. Very true.
Zach, I like that you said it's hard to know when the organization is ready or how much needs to be ready, because that's really what we're talking about, right? Setting up the structures and the supports for students, not waiting for the students to be ready, right? We're preparing it for the students. So I like that.
Okay, any other thoughts? Oh, did you, anticipating certain barriers or challenges, did you take specific steps that allowed them to be mitigated? And Claire, thank you for your comment. Need staff and site admin buy-in. Absolutely. And that's exactly what we're talking about with the whole culture piece and people having clarity, and then, you know, having those first set of supporters who will buy into what you're doing. Okay, and there's a little handy tip for everyone from Jessica. Moskant out of Harvard has a change wheel you can use as a tool prior to scaling. So just evaluating where you are and are you ready to take the next big step? Thank you. All right, so I think we have written that one down. So again, just a quick review with the PDSA worksheet. The scope of what you're going to do is really going to be documented in this section here within the PDSA worksheet where my cursor is, if you can see it. But strategy is embedded throughout, right? This is the plan section, and strategy and plan are kind of go hand in hand. So you're really talking about, okay, now what are you going to do? You have identified the root cause. You want to solve the problem. What is going to be your approach? So strategy is really embedded, and we'll go through specific aspects of it as we move forward. So then we move into, okay, now you have to identify goals and specific measures that you want to target. So let's talk about goals and measures. In any organization, there are always diverse priorities for the organization itself, but also for the team members. And assuming those diverse priorities, what process did you use? Did you use a specific process, or how did you go about even prioritizing, okay, these are the goals that we are going to target and we are going to measure? Was there a specific process that you used? And feel free to just share verbally. You don't have to be restricted to the chat. I know some of you are having mic issues, but if you'd like to use the microphone, please go ahead. So just a note, as I'm seeing some comments in the chat box, some of you are chatting with only the panelists. So if you want to change the setting to all panelists and attendees, then everyone can see the comments that you're typing out. So if you just want to, there should be like a couple of different options, and you can set it to all panelists or just all panelists and attendees. It was just the version of Zoom that you had that made you either a panelist or an attendee. But coming back, did any of you have to kind of scale down the goals that you were writing?
Or even as you're starting this process, are you considering that there may be some prioritization that needs to happen as you are new enrolling this out? Is your priority maybe a certain grade level or a certain school site or a certain area of change?
Okay. And Claire has answered. She said that they used a needs survey from the site in order to help visualize and prioritize goals. So great. So you got feedback and input across the site in order to help prioritize, okay, which goals are we going to target? What are the priorities from the people who are going to benefit from the change, right? Or who are going to be impacted by the change? I think that's great. Any other thoughts? Sometimes it happens in an organization that you have a problem and you have all these different things that you can do in order to address it, but they will impact different areas of your organization. And I think it all comes back to how you map it back to what is the final vision mission that you have set out to achieve. So sometimes that brings clarity if you can tie back all your initiatives to the final goal, and you can say, how will this goal, or which one in terms of a timeline, will make the greatest impact or make the soonest impact? So some of those questions, if they're asked in the most appropriate manner and framed in the right way, and they help make every part of the team understand what it is that they set out to do in the first place, it helps you to kind of ground yourself. That might be a good prioritization process to address what you are going to start out with. Okay. Okay, thank you, Charles. So Charles has shared that their measures were twofold. One, they wanted to show increased access to students. So they were tracking the number of co-teach classes we offered. So great, you have the goal, and then you're looking at the specific data measure that you are going to track in order to monitor progress. And you also wanted to track the success of your students with special needs in those inclusive environments. Okay, great. And you have achieved a lot of success, so congratulations. Any other thoughts? Anybody else wants to? Okay, Zach, thank you. Mental capacity of a tier 1. Great. So Zach, again, you wanted to build a capacity. Was there a specific measure that you were looking at that was tied to that goal? Mm-hmm. Right.
So yeah, we in terms of our instructional model and what we're doing in tier one, we had a similar kind of idea where we needed to be able to support more varied learners, and but really we also needed a best practice for instruction, especially with Common Core. And so we chose to say, well, we need best practice for instruction, and that's why we're utilizing Universal Design for Learning as a primary lens for instruction. And then now making sure that they understand that this supports inclusive practices and it supports the varied learning needs of learners. But we tried to just show that it's best practice first before we use it as only an inclusive measure.
Great. No, and I think whatever works. So I think that was a brilliant strategy that you adopted, where you went with, okay, this is best practice and this is what we're going to use. And yet you accomplished the goal of meeting the needs of all learners and being more inclusive. So I think that was a great strategy right there. Okay. All right. So in the interest of time, I'm going to move on from this. But I think even as we are discussing some of these questions, it would be interesting if you took these questions back as you're moving through this process and just reflect on how this is going to be for each of your teams in the future even. So again, cycling back to the PDSA worksheet, here's where you would document the prioritization process that you use. So this is specific to if you decided on an evidence-based practice was a specific measure used in order to prioritize. Now you can use different measures that are specific to your district. It could be part of, or it could be just a strategy that you adopt that is very effective for the context that you're working in. All right, and so moving on to the last point within our building stage, which is related to policies and procedures. Now, policies and procedures are important, or practices are important. So there's policies and procedures, and then there's practices, right? You are deciding to go ahead on a specific plan of action. You decide on a specific practice, as Zach did with UDL, and you have to think about, okay, now what policies or procedures need to change, they need to be added, what needs to be kind of tweaked so that this practice can be implemented appropriately and we can have success with this. So just curious to know your thoughts about, and I'll throw it out there all together, policies, procedures, practices. When you started out on this process of change, or as you are embarking on the process of change, do you anticipate any of these policies and procedures that were specifically changed, or were any practices specifically changed in order to get the results that you'd wanted? Not sure if someone wants to share. And I'm sure, Kristen, there was an example that you were talking about if you'd like to share regarding policy or practice.
Yeah, a couple different districts we've worked with have adopted, policies at the board level. I was thinking about specifically kind of how it started in this hierarchy with one district I worked with, where the district adopted 4 types of different goals and initiatives, and one of those was around student engagement. And so they went with the innovation of using cooperative learning strategies and trained all of the staff, from admin to teachers and paraprofessionals on use of cooperative learning strategies. And then the policy around that was, as we move through this new innovation, we're going to try this once a week in one lesson once a week. And then it moved to now do this, twice a week and 3 times a week. So they started scaling up as people got more comfortable in using these different cooperative learning strategies. Mm-hmm. And then different admin would walk through classrooms and support teachers on that. What did we intend it was to look like and to benefit students, and getting feedback from the different teachers. So it really started, or different educators across the board. So it started from kind of this vision of how to engage more kids. What's the innovation we're going to use? We're going to train on that. We're going to implement it. And then we're going to create a policy around how that should look in classrooms.
Thank you. And thank you, Charles, for your comment there about co-teaching practices. So as you moved towards co-teaching, were there any challenges or barriers or successes that you'd like to also comment on or talk about? Barriers, of course. No, we expected it to be very smooth. Were the barriers, just curious, were the barriers, could the barriers have been creating a sacred environment? Okay, for co-teachers, collaborative time. That was kind of the question that I was going to ask, which is, sometimes the barriers have to do, regarding the implementation of a practice such as co-teaching, have to do because the structural supports in regards to policies and procedures have not been put in place. So we start out with a practice, but we have to take into consideration that if that practice has to be truly implemented with fidelity, then does it require a change in the actual structural format of our day-to-day functioning? And that's where policies come in, right? And that's where the support comes in, and for you to be able to change or modify a policy or even add a new policy. So that's why policies and practices are very connected and tied together, because one success is definitely influenced by the other. And all of them contribute to building a successful culture. Thank you, Zach. Collaborative time between GE and special ed teachers. And I think this is something that we hear over and over again, just the time that is needed, and how can we plan for that and arrange for teachers to have that time. But I'm glad, even though it took time for you to solve, I think you did it successfully. You don't have the scale of collaboration of co-teaching teams though yet. Oh, you'll get there. You'll get there, Zach. You have faith.
And Charles, you just created time, right? You just moved to a 7-day period to create more planning opportunities. So really changed what that master scheduling looks like, and we talk a lot about how we're the ones, again, who create the systems and the structures. And so how might we make more use of the resources that we already have by changing our master scheduling?
Mm-hmm. Common planning periods. Mm-hmm. Thank you. So with regards to that, thank you everybody for sharing. I think when you share out what successes you had, what was your strategy, and what how you achieved it, I think it helps our entire network of SIP to benefit from it. So we appreciate your contribution to this webinar. All right, so just going back to the PDSA worksheet, any practices that you're considering, and then you will be moving forward with, you document that. And so really the PDSA worksheet turns into be an active working document, which you can then go back to and refer to and share with others in terms of what you did, why you did, and what were the challenges, the successes, the data that you considered, and so forth. And with that, I am going to turn it over to Kevin.
Great, thanks, Seema. If you hit forward a couple times. Page 3 actually focuses on the do and the study components of PDSA. And then the last page is really looking at what your next steps, how to determine what your next steps are by looking at the data. And as we mentioned before, it really helps you to determine whether you're going to adapt, adopt, adjust, abandon. And then what's the next cycle look like as you move into the next PDSA improvement cycle? Are you going to expand the process? And then what steps will you need to take to scale to create a level of sustainability across the organization? And the last thing in terms of PDSA that we wanted to make sure that we addressed was that it's rooted in assessment. It's that data piece, and whether or not the data that you're collecting is reflective of the innovation that you are trying to implement. And there also has to be an accountability piece. If you've ever looked at implementation science, at the top of the driver's triangle is the fidelity component, the fidelity of implementation, and then the accountability of ensuring that whatever innovation we've chosen to implement is implemented with that fidelity, but also those users that are implementing are accountable for implementing as designed.
All right, so moving on really to what's next. We have our next webinar on January 15th, where if you like this format, if you like how this webinar is presented in terms of the content, but also the engaging piece, we definitely want to move forward with that design for January 15th. So the survey is really important for you guys to complete at the end and let us know your thoughts on that. I think we had a lot of engagement today, and we really, again, just cannot tell you how much we appreciate that, because we're learning from each other. This isn't just, you know, our team rolling out a process and a set of guidelines and teaming together, but really sharing across the state what's working, what challenges we faced, and how to help each other through those as we grow together. So that's really important. We're going to be talking about implementing and growth and capacity and accountability, as Kevin just mentioned. And again, continuing that clear messaging as we're implementing new innovations and change. So our events, as I mentioned at the start of this, we have quite a few that we've added. The Katie Novak series begins this Thursday. If you haven't had an opportunity to register for that, I know we have limited spaces just based on Katie's bandwidth to be able to respond to her participants, but please feel free to send us a message or continue to register a couple folks who you were hoping to bring on board there at the end. That starts on Thursday. Ann Benninghoff will be joining us February 4th at the Endowment Center in Sacramento, addressing students with significant needs and inclusive practices around that. Our San Francisco State University workshop on inclusion, targeted specifically for the early ed population, will be February 7th in San Francisco. We recently just added UDL boot camps with Dr. James McKenna out of LA County Office of Education, who will be providing a North Central South 2-day workshop free. Again, all of our events are at no cost to participants. So as we roll that information out, please feel free to register for those events coming up. And then, as we mentioned before, Inclusive PD at Chime with Dr. Aaron Studer and his team is something not to miss as well. So many, many events being added, and we have more coming as well. We'll be having Dr. Anthony Mohammed from Solution Tree presenting a North and a South PLC and RTI series, so you'll hear more about that as well. And just a reminder, these events are scheduled and provided to you based on your feedback and what districts are telling us they need out in the field. So being very responsive to your needs. So please feel free to continue to send those to us, those needs. And just some reminders, please continue those quarterly meetings with the exemplar and grantee sites and with us, so that we know what we need in this project moving forward and how to best support you ongoing. And so with that, the next set is really just the survey. Again, here's the link that'll also go out through the OMS system for those of you who registered. To please just click on that link and send in your feedback. There'll also be the link for the recorded and archived webinar from today. And then the PowerPoint will be posted on the Padlet wall. So that'll be available right after this webinar as well. So we'll check our chat box real quick before we sign off. Everybody's saying great.